Good afternoon, New Brunswick, and welcome to today's COVID-19 update on the Back to School plan. We are heading to the conference room right now with Minister of Education Dominic Cardy and Dr. Kristen Mook, the Deputy Minister, our Public Health Officer.
Spread of COVID-19 in our school. Measures designed to protect every New Brunswicker from every other New Brunswicker at a time when we had no vaccines to help us in this fight. And thanks to the outstanding work carried out by teachers, administrative and support staff, our school districts, our students, they were able to learn throughout the year with minimal disruptions to learning, limited cases in our schools, and very few in-school transmissions. At the same time, I'm not going to pretend that last year was an easy year. The plans that were rolled out in August of 2020 changed, were updated based on science throughout the year. As a government, as a system, we asked you to be flexible and to adapt as new information became available to us or that we learned about the experiences of other parts of our country or the world. I know that anxiety was often high throughout the year, especially as the situation evolved and case numbers grew in many regions, and that meant that there were more cases in schools. And so I want to thank everyone for their patience, for their collaboration, and most importantly, for their kindness that they showed throughout the year to students, teachers to students, the staff, to all the little ones who they look after, and to parents as well, for sending their kids off into an uncertain world and for giving us their trust that they would come back home safely at the end of the day. I
wouldn't insist enough on the fact to recognize the work made by the people from the RHAs, from contact tracers, people from schools and staff. They have worked during very long hours to make sure that schools, in fact, were safe and that learning would be the least disrupted possible.
New Brunswick students across the entire province only lost 28 days of learning in the 2021 school year. That means just 28 days lost. One day here in one school, a couple of days in another school, totaling 28 days. An exceptional record, again, is a testimony to the hard work that everyone put in to keep our schools safe. We had 50 schools impacted by COVID-19 and around 100 confirmed cases. And that did involve some learning disruption, but again, in most cases, it was minimal and short-lived. And for the most part, schools were able to transition quickly to home learning, and thanks to the superb work of our contact tracers and regional public health authorities, students who did become sick were isolated and learning quickly resumed. Nous avons beaucoup appris grâce à cette expérience.
We have learned so much from this experience. The protective layers that we have put in place in our schools enabled us to limit not only the spread of COVID-19 in our schools, but also the spread of other transmittable diseases. The 2021 school year has seen fewer colds and flus during the school system.
We saw declining numbers in COVID cases province-wide as vaccines started to do their work. And I want to thank all New Brunswickers for rolling up their sleeves and taking the one step that can get us out of this pandemic once and for all. And it's a good point to remind folks, get your shots now. School starts in just over 2 weeks. If you haven't got a shot yet, if you work in the system, if you're a student going back to school and you're eligible for a vaccine, go and get your shot. You'll have one shot if you've got none, and it'll be effective in 2 weeks' time, at least partially. Then you can get your next shot and be fully protected. And that means you're playing your part in putting this pandemic behind us and in protecting the people that you care about. So, spring of this year, we saw cases drop. Recently, we've seen a spike again. This is not a surprise. We knew as measures to protect New Brunswickers were lifted as we move into green, that the emphasis shifts from government enforcing measures to citizens embracing protective measures. But that doesn't mean that government is exempt from having to put rules in place to protect the most vulnerable. Because we know COVID-19 isn't going to be disappearing anytime soon. And while the province has moved to green, we still don't have an approved vaccine for kids aged from birth to the age of 12. And so that means that students from kindergarten to grade 7 can't be vaccinated for this school year. We're optimistic, hearing from the vaccine manufacturers that approval is coming in just a few weeks from now, and I hope and pray, and I'm quite sure that the federal authorities will quickly move to approve those vaccines here for use across the Canadian provinces and territories, and we'll certainly be working closely to make sure that happens. We know as well that in our early childhood education sector, that there are kids much younger, infants, who are going to be wondering what measures are in place to help protect students who work who are at our facilities and people who work for us in early childhood education centers. And over the course of the coming days, we'll share information about how that sector will see their life changed as a result of the COVID restrictions in place for this school year. But clearly, with the pressure imposed by the start of the K-12 school year, we need to get this plan out now. And so I look forward to sharing more details on how we'll work to protect our younger students and students of all ages and the staff who work at our early childhood education centers, who took a lead role, let's not forget, in March of last year, when everyone was scared, everyone was staying home. Early childhood educators stood shoulder to shoulder with our healthcare workers, and they went to work and looked after our province's kids at a time when the province desperately needed them, and that will not be forgotten. Back into the K-12 system, we know that some older students of all ages, staff as well, who are immunocompromised, cannot get vaccinated. We need to protect them. We see this especially in the context of new variants sweeping the world, new variants that pose increased risks in some cases. New information and research is becoming available to us every single day, and increasingly so over the last few weeks, and as we watch the experiences of other jurisdictions as they fight back against the latest version of COVID-19. As we look to protections for this place, first, the biggest one. I was thrilled this week to see our government announce that government employees will be required to receive a vaccination for COVID-19 or to undergo regular testing and wear a mask at all times. This applies to school and district staff across the education system and provides us with an excellent defense. And I know that nearly all staff and teachers have already gotten their vaccine and are looking to get their second shot if they haven't yet. And we saw in the spring when a group of high school teachers had the chance to get vaccinated, we saw rates of uptake over 90%. And I'm confident that's going to continue. J'encourage fortement.
So I would strongly encourage teachers, EAs, bus drivers, custodians, the administrative staff, and any other members of staff who work in the school system who did not receive a first or a second dose to make an appointment now to get vaccinated now before the beginning of the school year. They're only 2 weeks before the beginning of the school year. Bad news for children, but we need to take this date seriously. It's an opportunity to improve the vaccination rate and to protect our youth and the most vulnerable in our community. And this call is also for educators and other members of the sector of early childhood, including the stakeholders. You work with young children who cannot get vaccinated. Please help them to remain healthy and safe.
Factors into consideration. Our goal has gone from having a school year that is as close to as normal as possible to one that has some measures in place, keeping susceptible students and school personnel safe, especially those who can't get vaccinated for a variety of reasons. And that means students who are depending on the rest of us, individuals, their friends, their families, businesses, their whole communities, to help keep them healthy and safe. So a big part of this year's Back to School plan is about everyone watching this broadcast. Please get your shots. Encourage those around you to get theirs. This is the way we keep our schools safe in the 2021-2022 school year. But of course, there are going to be additional measures. But we have to first remember the purpose of school, to provide a learning environment for our students, an opportunity for them to learn social skills and to become fully formed, happy, well-rounded citizens. School is incredibly important for the mental well-being of our youth and for their physical protection. We, of course, have to balance these factors in every decision we make. And that's why we're going to continue to embed layers of protection against COVID-19 in our education system. I hope that this will allow us to have a year like last year where disruptions are minimized and that our students are able to enjoy greater freedom and opportunities within our schools, while at the same time always keeping in mind the importance of protecting those who can't yet get vaccinated and those who are vulnerable. We look forward to being able to, with limitations, return to sports, clubs, and after-school programs, but again in the context of responses to Delta and the other new variants of COVID-19 that will continue to emerge as long as portions of our population choose not to get vaccinated. New variants come from people who are not vaccinated. The more people who choose not to get vaccinated runs the risk of ever more infectious, ever more lethal, ever more dangerous variants that can further destabilize and uproot our lives, our communities, and bring heartbreak, pain, and suffering to all of us. Please get your shots. We've seen some basic principles that have proven effective over the past year at reducing the spread of COVID-19 and other illnesses. A lot of those are going to remain in place across all age groups for this year. As usual, when students or staff are sick, stay home. You do not impress anyone with your work ethic if you make everyone sick. If you've got 2 or more symptoms, get tested. Follow advice from public health. They've led us incredibly well over the last year and a half. Let's not let down our guard now. Une bonne étiquette d'hygiène respiratoire.
Good etiquette for respiratory hygiene will continue to be taught and encouraged in our schools, and frequent surfaces that are being touched will be disinfected. The school staff will continue to encourage hand washing before and after playing outside and after meals. Children and the staff will wash their hands or disinfect their hands before getting into the classroom. The students and the staff will continue to bring water bottles with them for the whole day because the water fountains are not authorized, and schools will continue to use the filling stations.
We carried out testing in schools that did not have integrated or mechanical ventilation systems, and all tests were found to be in the safe range. Nonetheless, to promote optimal learning and working environments, we have launched a provincial multi-year program to install ventilation systems for better airflow in schools. And as we continue this long-term project that'll be carried out over the course of a number of years because of the amount of work required, we're going to continue to work with school districts to promote healthy air circulation within schools across all age groups. But this year, we will be able to open more activities across all age groups, including removing restrictions on music classes, interscholastic and intramural sports, and extracurricular activities. These, of course, are all reopenings that are subject to public health guidelines and instructions. If there's an outbreak, if there's a case, we're going to be listening to public health to make sure that students are protected. But when things are good and safe, we want students to be able to take advantage of all of the opportunities that being at school offers, because we've seen the mental health toll that the last year and a half has taken on our young people, and we have to do our very best to minimize that while balancing the requirements for public safety over the course of the coming school year. So students in kindergarten to grade 8 will no longer have classroom bubbles, will be able to interact more freely with other classes, and they'll also be able to return to regular group sizes. Part of that is because of our shortage of teachers, which I've talked about on many occasions. We've heard from many teachers about positive experiences with smaller groups, but at the same time, we're still left with a system where we have to make sure we have a teacher in front of every class. So we're going to continue to do our best to work on ratios over the coming years, but are confident that we can safely return to regular group sizes this school year. That's why we need to ensure that protective health measures remain in place to keep schools healthy and safe for students, and that a few additional precautions will remain in place at schools across the province, and some new ones as well. In the case of schools with students in kindergarten through to grade 8, students and school staff will wear masks when they are in common indoor areas, and assemblies will not be permitted. Les visiteurs dans les
Visitors in schools, in fact, will be limited. They will need to have an appointment and wear a mask. The community use of our schools will also be limited to the activities and organizations for youth. Schools from K to 8 will manage also the circulation in the hallways in order to avoid congestions and contacts that are not necessary with other people.
To encourage schools to use open air and outdoor spaces whenever possible for activities and for learning. Of course, that depends on the weather. But by following these practices, as we transition to living with COVID-19, we can support our students in a more normal, day-to-day round of activities, a more normal life, and so that they can enjoy their childhood to the fullest, despite the requirements necessitated by the pandemic. So at the high school level, I'm pleased to share that students will, as expected, return to school full-time and in-person learning for this year. However, vaccination rates for this age group continue to be lower than anticipated and vary by health zone. The vaccination rates for 12 to 19-year-olds are not yet at a point where there would be significant protection in the event of an outbreak. Ainsi, des couches supplémentaires de protection sera...
So additional protection measures will be put in place at the high school level, other than the measures of washing your hands and staying home when you're sick. We want to encourage activities and learning outside when weather permits. Visitors will be limited by appointment only and will wear masks.
Will be permitted. Masking will be required, and high schools should consider hosting smaller assemblies and using outdoor spaces whenever they can. We have roughly 70 high schools across the province, and they vary enormously in size. So things could again this year, as they did last year, look quite different from school to school. Finally, additional measures will be in place for high school students until the rate of vaccination among those aged 12 to 19 in a health zone reaches 90% double vaccination. Those include the requirement of students and school personnel to wear masks in common indoor areas and limiting the community use of schools to youth-based organizations. Once the 12 to 19 age group in a health region reaches 90% double vaccination, mask use will become optional and community use of schools will be permitted for high schools in that region. And I'd remind folks that at this point, we're looking at numbers around approximately 50% for that age group in most of the health regions across the province. And so to help students reach this goal, districts are going to be working with public health to create more opportunities for students to get vaccinated, just like they did this past spring. Cela inclut le transport en autobus.
This includes transportation to clinics and pharmacies. More information regarding local partnerships will be available for all districts after class has started.
We anticipate we will continue to see confirmed cases impacting schools. This has always been clear. As always, our goal in managing outbreaks continues to be keeping schools healthy and safe while minimizing disruptions to learning. And Dr. Muick is going to be speaking about this process in detail shortly. What I will share is that for this coming year, schools will be closed. We'll move to online learning or have an operational pause, same as we had last year, for one calendar day to allow for contact tracing and testing if the confirmed case has a direct impact on students. Our contact tracers and regional health authorities have done outstanding work, often into the late hours of the night, to keep disruptions to our schools to a minimum. But we hope that by taking that day, we can support families, reduce uncertainty and anxiety, and continue, as we have throughout the pandemic, to follow the science. So this is a new measure, a stricter measure, and one that I think is an appropriate way of handling a variant of COVID that is much more transmissible and can move much more quickly once it's established. So to nip those outbreaks in the bud, this pause, I believe, is an effective and appropriate measure. If a case is confirmed on a Friday or on a Saturday, students should expect to return to school on Monday unless they get communications from the school or from public health, same as last year. If you don't hear from public health, continues, no news is good news. La santé publique, les écoles continue.
Public health, schools, and school districts will continue to collaborate and minimize the disruptions to learning as much as possible to ensure, in fact, the health and safety of children and staff. Schools will continue to have emergency plans in place if a case is confirmed, and the learning will have to be from home. For those who are in high school, there will be self-managed projects and learning online. For those who are from K to 8, this could be a mix of working at home, working online at home, and learning kits on paper.
In our efforts to try and improve our school system throughout the pandemic, that our efforts to move schools online, make sure all high school students have access to an iPad or a similar device, and that there's at least one electronic device in the home of every K to 12 student. We're continuing with that program because we're doing our very best to make sure that we don't just act on the defense from COVID, but that we do our best to improve the system based on the experiences we've learned handling this disease. And so over the past year and a bit, we've had lots of opportunities to examine best practices, learn from the experiences of other provinces and other countries to make sure that our system can be agile and quick to respond to changing situations. And again, I want to thank everyone in the system for their incredible work in making sure that happened and keeping those days lost in the 2020-2021 school year to a very low minimum compared to just about every other place in the world. As with last year, we anticipate that our plan can and absolutely likely will change based on new evidence, based on the science. We had hoped to go out with this plan a little while ago, but over just about a month ago now, we received new information from the CDC and other World Health authorities making clear the impact of the Delta variant on young people. And so we went back and we said, we've got a hard deadline of the day school starts, but between now and then, our goal is to make sure we have got a plan that is rooted in science and best practices to make sure we protect our students and staff. So make no apologies there. But if the situation evolves in such a way that we need to embrace even stricter measures, we will not hesitate to make that happen. It's my hope, though, that we can have a more positive conversation and that we can look at, towards the end of this year, having a review of the current plans, and hopefully they can be lifted or at least loosened. But that depends on all of you. If we have a province that's vaccinated, we have a province that doesn't need COVID protections. But we're a long way from that, and I need all of your help to keep our students safe this year. Our kids are depending on you to have a safe and fun school year, and it's in your hands to make that happen. Your hands to protect them, your hands to make sure you don't contribute to the evolution of a new and more dangerous COVID variant that could ruin next school year for our young people. Please do your part. Nos plans seront évalués.
Our plans will be assessed regularly during the year based on research, best practices, what we find at the international level, and public health.
Together. And we're in a place where we can enjoy so much more freedom because of vaccines. But COVID is still here, still coming up with new ways to try and get around the vaccines. And of course, as I've talked about, we still have lots of New Brunswickers, especially our little ones, who can't yet get vaccinated. So please, you are our front line against COVID-19. Make responsible choices every day. Where you go, who you talk to, how you act, when you wear a mask. Help protect our students and keep all of our vulnerable populations safe. S'il vous plaît, continuez à adopter chaque...
Please, every day, have a good behavior and ensure that we protect our students and a vulnerable population. Together, we can help our students to enjoy a more normal school year and keep our school healthy and safe.
And the world's going to judge us. The last year and a half, New Brunswick showed that we could reach heights that I think many of us didn't think we could. A disease that ravaged countries and communities with even more access to advanced medical care than we have, with huge resources that this little province does not have. We showed up and we showed the world that a population that was ready to listen to experts, follow the science, and just to make reasonable, small, day-to-day decisions, wearing a mask, maintaining social distance, we could beat the world. Let's keep at it. Merci beaucoup.
Thank you very much.
Minister Cardy, Dr. Muick.
Good afternoon, everyone. Bonjour à toutes et à tous.
Good afternoon, everyone.
Minister, for your comments. I just wanted to underline as well the incredible collaboration and work that has occurred between education and public health. We have, throughout this pandemic, continued to work closely together to protect students and staff, and we continue to do so. We'll continue to work together, continue to work to look at the evidence and adjust as needed. So thank you for your collaboration thus far. Le Nouveau-Brunswick est...
New Brunswick is at the recovery phase of the Green Plan regarding COVID-19, and this has been in place for 3 weeks. So it was possible, in fact, to live with fewer restrictions.
3 weeks, New Brunswick has been at the green level of our COVID-19 recovery plan. This has given us the opportunity to go about our lives with fewer restrictions. After nearly a year and a half of living with public health measures, this is a welcome change to many New Brunswickers, but has also caused some anxiety. The virus has not gone away, not here, not elsewhere in Canada. As we expected, there have been new cases reported, mostly amongst those who have not yet been fully vaccinated, and these have occurred in all health zones. Until the vast majority of New Brunswickers are fully vaccinated against the virus, we will continue to see new cases and outbreaks of COVID-19. We are getting there, but we aren't there yet. Getting vaccinated is the surest and most effective way to protect yourselves, your family, those who cannot be vaccinated, and your community from the COVID-19 virus. If you or your children, 12 years and older, are not yet fully vaccinated, I urge you, as the Minister has already, to make an appointment as soon as you can and get vaccinated. D'ici à ce que la très grande
Until the vast majority of New Brunswickers are fully vaccinated against the virus, we continue to see new outbreaks of COVID-19. We are getting there, but we aren't there yet. Getting vaccinated is the surest and most effective way to protect yourself, to protect your family, those who cannot be vaccinated, and your community from the COVID-19 virus. If you have not been fully vaccinated yet, I urge you to make an appointment as soon as possible. Bien que nous aidons le plus grand nombre de Néo-Brunswickois et Néo-Brunswickoises d'être vaccinés, la vie doit continuer et nous devons continuer à vivre avec la COVID-19. Dans 2 semaines, les écoles ouvriront et les élèves retourneront en classe. Et le ministre Cardy a fait état du plan du ministère pour ce qui est de l'année scolaire à venir et la santé publique a participé à un nombre de ces discussions. Aujourd'hui, je tiens à parler de pourquoi il est important de s'assurer que nos élèves retournent en salle de classe et d'expliquer en fait pourquoi nous avons des normes élevées en place pour s'assurer que chaque élève, chaque classe, chaque enseignant en santé et en sécurité. Lorsque je parle en santé et en sécurité, je parle de la prévention de l'infection, mais je fais également état de la santé de tous et toutes.
Les écoles du
Schools in New Brunswick have had a lot of success during the pandemic of COVID-19.
s'est poursuivi.
Learning has continued with minimal disruptions through the past school year compared to other jurisdictions. In reviewing reported cases over the past year, it is clear that schools did not drive any of the outbreaks that occurred
During the COVID-19 pandemic. Learning continued with minimal disruptions through the past school year compared to other jurisdictions. In reviewing reported cases over the past year, it is clear that schools did not drive any of the outbreaks that occurred. As Minister Cardy mentioned, for the most part, infections of students occurred outside of school, in gatherings of families and friends, and so on, rather than the classroom. Je tiens à remercier tous.
I would like to thank all teachers, parents, students, people helping for the excellent efforts that were made in order to protect our schools during the last year.
Brunswickers, teachers, parents, caregivers, and students for the extraordinary efforts you have made to keep our schools healthy over the past year. This fall, New Brunswick's high school students will return full-time in-person learning, and K-8 will be retaining some protective public health measures as outlined. This is a positive development for every student, for their learning, as well as for their overall physical, social, and emotional health. But we must recognize that COVID-19 virus remains an issue, particularly for those who are not vaccinated. Public health will work closely with the Department of Education and Early Childhood Development to keep schools safe. We believe that continuing the use of masks in schools in common areas, along with other measures such as frequent hand washing and use of outdoor spaces where appropriate, will minimize disruptions and limit the spread of the virus until further vaccination is possible. Enabling a return to a more normal school environment requires that we put a very high premium on protecting students' health while balancing the need to support healthy development. Public health will work with the Department of Education and Early Childhood Development and local schools to provide opportunities for eligible students to become vaccinated. Even with these precautions, we need to be prepared should the virus find its way into some of our schools. When that happens, there'll be there will continue to be processes to protect students and limit the spread of the COVID-19 virus. The process will be very similar to what it was in place last year when we were successfully able to limit the impact of outbreaks in our schools. And of course, this will also take into account the vaccination status at the time. When a positive case of COVID-19 is confirmed within a school, public health will, as we always have, worked with the school and district staff to carry out a detailed risk assessment. This assessment will examine a number of factors, which can include how prevalent the cases are within the greater community, the type of COVID-19 variant involved, how many close contacts the individual who is positive has had, and how early the case was detected, the layers of protection that were in place at the school, such as masking and assigned seating, the vaccination rate of the school, and the layout of the facility and shared spaces. Based on the risk assessment, public health may direct students and school personnel to take one or more actions, and these actions could include directing individuals identified as close contacts to learn or work from home, directing groups of individuals, such as a classroom, a bus route, or a grade level, to learn or work from home, or potentially directing groups who work and learn in a particular area of the school to learn or work from home. In the most extreme example, it is possible the entire school will be directed in a similar manner. Lorsqu'un cas du COVID-19 sera signé,
When a COVID-19 case will be raised in a school, if there's confirmation of transmission within a school, the school will close, will offer distance learning for at least one day in order to enable contact tracing and risk assessment. We will work tirelessly in order to reduce the risk of transmission of COVID-19 in our schools, but this risk will never completely disappear.
the case of COVID-19 is reported in a school or where there's a confirmed incident of in-school transmission, the school will be closed operationally for at least a day or switch to distance learning to allow for contact tracing and risk assessment to be carried out. We will work very hard to reduce the risk of transmission of COVID-19 in our schools, as we always have, but the risk will never be zero. The preventive measures that protected our students, teachers, and communities during the last school year are still effective today. Please continue to use these skills in your daily lives, in school, and at home. And please, if you are eligible to get vaccinated as soon as possible. Now, in addition to these measures we've been using for more than a year, we do have these vaccines that are proven to protect us safely and effectively from the most serious effects of the COVID-19 virus. A majority of New Brunswickers are now fully vaccinated, but more people in our communities can and must roll up their sleeves. By getting vaccinated, we can protect ourselves and those around us. This will help us get back to the normal life we all want. After 18
months of mixed learning, bubbles, classes, and other restrictions, our children deserve to have a school year as normal as possible this year. Thanks to your help and your support, we will be able to offer this important gift. Thank you very much.
Questions from the media. Each reporter will have one question and one follow-up. Time permitting, you'll have a chance to ask an additional question. You can ask your question in the language of your choice. Nous allons maintenant
We will now move to the questions from reporters. Each reporter will have one question to ask. If time permits, you will have an opportunity to ask an additional question. You can ask the question in the language of your choice. Laura Brown, CTV.
I'm wondering if you can clarify use in schools. There's some people on Twitter that are asking, does common place mean cafeterias, classrooms, hallways? Will they be required outside? That kind of thing. Can you just, wait, on school buses?
Laura, great to actually see you in person again. Absolutely, I should have actually included that in my speech, especially around buses. So common areas means just that, anything outside of the school environment, inside the school, the classroom environment, inside the school building. So if you're outside your class, but inside school, wear a mask. Buses, masks are mandatory, all students, all the time, on the buses, full stop.
And you mentioned some percentages on the number of staff and teachers that had been vaccinated already. Can you reiterate, at this point, to your knowledge, how many teachers and staff are vaccinated?
We don't have the ability to get that information easily because of privacy issues. So all I can say is that we know that when we opened up vaccinations for high school teachers and most other staff in the springtime in anticipation of a return to full-time learning then, which we didn't go ahead with because of the increase in cases, that at that point we saw over 90% uptake. So that's all we can say there in terms of that. So it's difficulty because of the privacy issues to be able to give clear answers on some of those questions, unfortunately. I'd certainly like to know the answers too.
How will you know then in the school year if they're vaccinated? Like, how are you going to track that?
Well, because there's now going to be, the big change is the announcement the Premier made the other day. We are now moving to mandatory vaccinations or regular testing and compulsory mask use for every single employee of government in New Brunswick, except for those who have medical exemptions, which is going to be a tiny, tiny number of folks. So that's the big change that's coming. And so the reason why the other day when the Premier said, stay tuned for the details on that, is making sure we have the exact timing and how that works in terms of each government part, how it's going to affect areas that are linked to but outside government. Those are all going to be spelled out in the next couple of days. But before we could have this briefing today on back to school, we needed to have the answer around, could we guarantee to the parents, to the students, and the staff across the New Brunswick's education system that at the very least government employees were going to be vaccinated as that first line of defense. And I'm, again, thrilled that we've taken that step.
Okay, thank you, Laura. Reed Parker with Global.
It's actually me, Natalie Sturgeon, Global. Minister Cardy, I know you mentioned that you were sort of developing this plan as the science was coming through, things are evolving, changing, but we spoke to a lot of parents who had a lot of anxiety and stress leading up to today. Why did it take so long to get this plan together, and how can you reassure parents that this is the best possible plan for their kids going forward?
Because we didn't react to anxiety. We didn't react to fear. When we saw new information, we took the time to get the plan right before the plan was needed, which is the day that school opens. We made sure we've got the time, and the system does have the time to put these measures in place across the school system, and that's what counts. And I apologize for the anxiety caused for any of the students, the parents, and the staff as they waited for this plan to come out. But I don't think any of them would disagree that much better to have a plan that took a few more days to fully bake to make sure that the science was included rather than rolling something out for PR purposes that wasn't going to protect our students and staff.
The next question is for,
I just wanted to add that in addition to what the minister has said, we do have to be prepared for the unexpected. That's been the case throughout this pandemic. So we do, as much as I agree that we need to allow this plan to bake, we also need to be prepared for the possibility that we need to adjust as we go along. And I think that's one of the areas that New Brunswick has excelled at, is being able to react quickly, being able to track what's going on, see what's happening in other jurisdictions, and adjust accordingly. And I fully appreciate why that's stressful and anxiety-provoking for many people. And I just wanted to thank all New Brunswickers for continuing to collaborate with us on that.
my next question is actually for Dr. Dominic, if you'll permit me. So given that the Delta variant in other parts of the world is attacking young students quite heavily, and they are responding to it quite negatively, is the masking and the rules that have been put in place for those ineligible for vaccines enough to protect them, given that they'll be in a full school environment?
Well, so as I've mentioned, we've looked at this very carefully. We've looked at evidence, what's going on in other jurisdictions, and we do believe that at the current time, this is the best plan for balancing both the infection control issues and ensuring that that we're looking at all aspects of a student's health and well-being, and of course the staff and other members of the school community. So yes, but as I mentioned just a few minutes ago, we do need to continue to keep a close eye on what's going on, and we do need to continue to be prepared to adjust as appropriate. So if we come back to students, staff, and parents at the end of September and say, you know what, we need to do things slightly differently now, that is because the situation has evolved, not because we're second guessing our own decisions.
Thank you. Merci. Kevin Bissett, Canadian Press.
Minister, have you, during this, consulted with the teachers union and have any of the things that you've done here addressed some of the concerns that maybe they've raised?
Yeah, thanks for that question. Regular touch with the Federation and the unions, not just impacting the teachers, but CUPE and New Brunswick Union too, who have workers in the education system. So it's been a collaborative process all the way through. I heard this morning from a couple of teachers saying, why didn't we have access to this plan earlier? And I want to apologize for teachers if they feel that in any way they were disrespected by that. They weren't. If we release a provincial plan to several thousand people before it goes out publicly, it runs the risks of rumors and confusion, and other groups would ask the same question: why didn't we know in advance? In the end, education, and teachers should take pride in this, is a provincial priority. It affects every New Brunswicker. And while teachers are on the front lines, I assure you that we've been in constant contact with the unions and the Federation, working on issues around this plan, and just like we work in every other area of the COVID response. And a moment to welcome the two new presidents of the Anglophone and Francophone teachers unions, replacing Rick Cumming and Gerald Arsenault, who are absolutely superb partners in education over the last year and a half in particular. And their leadership helped to make sure that New Brunswick's response to COVID-19 was world leading. So thanks for that, and thanks for the question.
And schools aren't always just a 9 to 5 environment. They're often used for adult language training at night or other community events. What's going to happen in that regards? Will they be sort of shut down at the end of the regular school day?
They will be not. The schools will not be open to non-student related groups, full stop, at any level. At the high schools, once the 12 to 19 age group reaches a 90% vaccination level, we will look at removing that restriction. But at this point, our schools are closed to groups from outside of the school community, outside of other school groups. We will allow inter-school work, but for adult groups and so on, unfortunately, we have to keep the schools closed. And the reason for that is we've got too many unvaccinated people in the province. So if we want to see those schools opened up to be the community centers they should be, and there's nothing I'm looking forward to more than removing all of these restrictions, and I'd like to see us go beyond where we were in 2019 and have schools be genuine community centers open for the whole community all the time. But that can't happen until we get our vaccination rates up. And that means 90% double vaccination levels for our high school students before that can happen. I hope it'll happen soon. It's up to the students, up to the staff, up to New Brunswickers to decide how quickly we can make that move.
Thank you, merci. Savannah Odd, Telegraph Journal.
First one, I guess either one of you might be able to answer. Is the government vaccination policy, how is it going to be enforced? I understand it's mandatory, but it's a recommendation at this point. And I'm also wondering how that will apply to long-term care, because from my understanding, they haven't really been given any policy of any kind at this point.
Yeah, and Dr. Muir might have something to add to this, but it's similar in education with the daycare sector, where you have a sector that has elements of the private sector, but at the same time, there's a heavy amount of government involvement, regulation, and funding as well. So we're going to be looking at how areas like those care homes, like early childhood education centers, how we can include them in the mandatory vaccination and testing program over the next little while. And that's one of the reasons why those specific details weren't shared in detail the other day when the Premier made the announcement. So we're looking at legal restrictions and the health requirements to make sure we can protect as many people as possible. Because I've certainly heard from educators concerned about having staff who refuse to get vaccinated, or staff concerned about kids coming in who aren't vaccinated. So all of those things have got to be considered. It's much easier when we talk about straight up government employees. Those areas sort of on the fringes of government work, it's going to take a little bit more time to make sure we get the answer right, but the time pressure there isn't quite the same as it is for education when we're back at it in 2 and a bit weeks.
Mm-hmm. Yeah, I can just add that, of course, the policy goal is to have individuals vaccinated, and they can show that they're vaccinated by providing their vaccine record. The alternative is that people are tested on a regular basis and wear masks in the workplace. So those are the two sides, right? And of course, the side that we want most people to land on is fully vaccinated.
And my other question is just around herd immunity, I guess. The latest expert, estimates of herd immunity now is that it's more like 85 to 90%, given the Delta variant, given the waning immunity we're now hearing about with vaccines. I'm wondering that given this, I mean, we're not anywhere near 85 to 90 for our population, why not mandatory mask or distance until we reach herd immunity? I guess what is the public health rationale for not doing that as a protective measure until then?
So I just wanted to speak to the modeling a little bit. You're right that modeling has been ongoing and an iterative process as we continue to see new variants emerge. And some variants are more transmissible than others. So that's why we're seeing variation in the estimated number of or proportion of people that would need to be vaccinated in order to achieve that what we call community immunity or herd immunity. I absolutely think that we need to continue to have layers of protection to protect all of ourselves against COVID-19. What the distinction that has been made, and Minister Cardy has pointed it out as well, is that we are moving from mandating across large populations to putting the responsibility and not only amongst government, which through policies like we've mentioned, but also continuing to encourage individuals to take the measures that are appropriate for them in their setting. So individuals look at their own situation, they look at the settings that they're in, they look at who they're surrounded by, and they can be encouraged to continue to mask, to continue to distance, to continue to hand wash. As the minister pointed out, we did see, not only in schools, but throughout our communities last year, we did see a significant decrease in common infectious diseases. So these are measures that are not just applicable to COVID-19, but they're measures that can help all of us remain healthier on a regular basis.
Public health recommends that you mask and distance still? Is that something public health recommends?
I think individuals need to look at their own situation, but certainly those options are still available to people, yeah.
Thank you, merci. Vicky Hogarth, CHCO-TV.
Thank you. My question is for Dr. Mook and Minister Cardy. Other provinces like Ontario and Manitoba have extended the vaccine to be eligible for people who are 11 years old who are born before December 31st, 2009. Is this something New Brunswick will consider doing, and do you think it could add an extra layer of protection in the school system?
So yes, we are also watching what's going on in other jurisdictions. This is something that's actively under consideration and will be looked at in the coming days.
My follow-up is just how, sorry, Mr. Cardy, go ahead.
I was saying that's absolutely something that we're looking to be able to move towards, and it's a logistical consideration really more than anything else. So it's certainly policy-wise the direction we're intending to go.
As a follow-up, how do you expect regular testing to work for teachers who don't get vaccinated, and will there be extra guidelines that they have to follow other than just the regular testing?
So we did mention as well that in addition to regular testing, if folks aren't fully vaccinated, there'll be masking at work. So that's the other side of that component. And then in terms of the logistical, how do we get people tested and how does all that work? All of those details are in the midst of being finalized.
Merci. Tom Bateman, Brunswick News.
Hi there, can you hear me?
Sort of.
Hi, is this better?
Yes.
Good. Minister Cardy, I wonder how specifically did this back to school plan change over the last month or so as new information on variants kind of came in from the CDC and elsewhere? What modifications were made?
We went through the entire plan, top to bottom, to make sure that it reflected the new science and guidelines. One of the things that I was really encouraged to hear was the province's decision to move on mandatory vaccinations for everyone, which I think is one of the most concrete examples of how we change not just the back-to-school plan, but our entire provincial response to COVID-19 in recognition of the increased threat that Delta presents to unvaccinated people, to vulnerable people, and to the kids who can't yet get vaccinated. So that's one very concrete example. The target for vaccination rates in the high school would be another. There would be some others, which I'm sure everyone will RTI at some point, but there was a list of things that were there in one form that were then tightened up, and some things that were introduced based on the new information that came along. Hope that answers your question.
Just add a point or two.
Yes, it does. Thank you.
If that's okay. Just to say as well that we do almost pretty much daily risk assessments in terms of looking at epidemiology, how the situation is evolving in other parts of the country, because that does influence what's happening in New Brunswick. Closely watching all of this information, and that does evolve. So to the minister's point, we have to take all of that into account. We're also trying to balance the risks and benefits, right? So the past 18 months have involved unprecedented actions, but as a result, it's led to a lot of fatigue and a lot of unintended consequences. And so we need to balance those as well. And just, there is a sweet spot in there somewhere. And we will be continuing to refine appropriately to make sure that we're not causing more harm than we're protecting from.
Thanks for that. This is for either of you, but I wonder if a mandatory testing regime for students over the age of 12 who choose not to be vaccinated was considered as part of this plan, and why or why not?
Yeah, we're continuing to work with public health on a sort of voluntary program for students to participate in a testing plan, because that is absolutely yet another tool that we can use to help keep COVID-19 under control as we wait for those vaccination numbers to rise, as New Brunswickers make the right decision to protect themselves and their families. So absolutely, it's something we're looking at. And there'll be other, as Dr. Muick was saying, we will continue to make changes based on the evidence and based on our abilities, based on what the science dictates. And looking forward to sharing other details on that in the coming months. But this plan gives us the framework we need to get into this school year.
Merci. Nathan DeLong, Brunswick News.
Good morning. Can you hear me all right?
Yes.
Okay, perfect. My question is for Mr. Cardy. I understand you mentioned earlier the new mandatory vaccine requirement for school and district staff and I guess government employees in general. And you mentioned during the previous vaccination clinics for school staff that there was a 90% uptake. But I'm wondering if you have any details on what percentage of school staff have either received a shot or been fully vaccinated to date, as well as students, what percentage?
We don't have the information based on workplace. We have the information broken down by age and health zone. So that's really all the information we have right now because of the privacy concerns that restrict our ability to collect that information. So we can ask for people to voluntarily disclose it. And there's been different efforts at different points by the department, by others to collect some of that data. But it gives us a snapshot, not a scientific answer, because we cannot mandate that people answer the question. So that's the issue right now, is that we have limited abilities to be able to collect some of that data. But again, some of the changes we're looking at making here are to try and make, with the mandatory vaccination and testing plan, it'll give us some more tools to be able to help make that happen. And we're again really pleased that through the clinics, we were seeing a 90% or so uptake at the high school. So I'm hoping that we're going to be able to see that target exceeded and get our levels up into the 90s. And I think one of the folks online said, we now know that herd immunity with COVID is approaching 90%. So let's do that. If we know that's what it takes to get us out of this, so we can get rid of all these restrictions, go back to normal, let's get those shots. The answer is simple. It just depends on each of us doing our part.
Thank you. My follow-up question is for Mr. Cardy. I heard concerns earlier this week at a district education council meeting for Anglophone North School District that the trend toward home learning for students and families with immunity concerns or other health concerns that may preclude them from participating in in-person classes may continue. However, there's questions about whether there will be staff in place to support students in that situation. So I'm wondering if you can clarify whether there will be any staff or resources in place to facilitate that option this year.
Yes, let me be really clear on what's, if a student stays home for medical reasons, we will absolutely do what it takes to provide support for those students, full stop. If a family chooses to take their students out of the public school system because they're concerned for whatever reason, but they don't have a medical reason, they'll be making a choice to homeschool their children. I'm not going to make any comments on that, but they're making that choice, and they will not be provided with any resources from the Department of Education. Hope that answers your question.
Yes, it does. Thank you, Mr. Cardy.
Thank you, merci. Mia, CBC.
Can you clarify the triggers for closing a school? Is it one case, and will confirmation of the Delta variant trigger a more robust reaction?
The one case means one case, and if it turns out to be Delta, that's exactly why we put this policy in place. If it turns out not to have been, we've been extra cautious, which I think is entirely justified given the risk that the COVID variant presents to our young people. But I can't think of anything we could do faster or more extremely than shutting down a school in the event of a single case. So if anyone comes up with any ideas on that, always looking for help.
And I wanted to follow up on the question about, oh, sorry, did the doctor want to?
Yeah, hi. Just to clarify, the one case leads to an immediate risk assessment. And as mentioned earlier, there would be 1 day of either closure or distance learning to allow for that risk assessment to be fulsome. After that, though, the actions that would be taken would be dependent on the risk assessment itself. So there could be a more prolonged period of distance learning or closure or not, depending on the situation.
Okay, thank you. So my follow-up, I wanted to ask again about mandatory vaccination for students. Minister Cardy, would you like to see vaccines mandatory for school-age children over 12?
Yes.
Full stop.
Yep, and under 12, as soon as it's legal. Yep.
Okay,
All right,
thank you. Merci. Oh, yes.
COVID-19 has received a lot of attention, obviously, because of the last 18 months. But it's not the only vaccine that is required for school attendance. So this will be, as we move through into a more integrating COVID-19 into our regular operations, it will be one of several vaccines that are required for school attendance.
Dr. Mulek. Simon Delatre, Acadie Nouvelle.
Simon Delatre, Acadie Nouvelle. Yes, hello. This is the question for Mr. Cardy regarding the 90% rate mentioned. Could you explain what justified that? What justifies this target of 90%? It's higher than what is required. Inaudible comment. I believe it's a question. In fact, why did we talk about a target of 90%? Yes, okay. This is based on a consensus that is changing, but in fact, we can't go higher than 90%. The herd immunity, when there is a percentage of the population that is vaccinated that will protect the others who are not vaccinated, what we hear is 85 to 90%. And this is why we decided to have this percentage for schools, for high schools. And it's also because of the Delta variant, which is more transmissible than previous variants. Thank you. So the efforts that are being made to encourage the administrations in high schools will be maintained. For example, clinics in schools or transportation of children to clinics in the community. Yes, absolutely. This will be maintained, and we will add to that, in fact, information campaigns in order to encourage youth to get vaccinated. We will work closely with public health, also with the communication team within the government, in order to say to all students, please get vaccinated for your friends, for your family, for your grandparents, for the community as a whole. So this is what we will continue starting in September and for the rest of the year up until the point we reach this 90% target. And we need to celebrate the success of youth who took the responsibility to protect their community. And I'm sure, just like the population has responded over the last 18 months with this campaign, I know that youth will impress us. I know that. Before the pandemic, public health and the education system have worked closely together in order to have vaccination clinics in the schools for other diseases. So this is not a new concept.
Thank you.
Oui, bonjour, est-ce qu'on m'entend comme il faut?
So my question is for Minister Cardy. So when you talk about tracing that will be done regularly, at what frequency? The frequency of tracing for the staff that is not vaccinated. So for the professional team at school, no, it hasn't been decided yet. And in fact, this is why that we needed to make the decision at the cabinet level for the government as a whole, following the advice of public health for the mandatory testing for people within government. But now we'll need a few days to specify how this will work for the various tests. But also, we also needed to tell everyone involved
la manière qu'on va gérer le système.
That this is how we will manage the education system in 2 weeks from now. So this is why we made this decision this week for mandatory testing and vaccination. And today we have the plan for back to school. And over the next few days, we'll have the details regarding the testing plan and how this will impact the various education centers and the various health centers. Thank you. The second question, how will you make sure that this will not have an impact on classes? Could tests, in fact, be done at school? Would be done out of the regular school hours? The detail will be shared with public health. We will see that in the next few days. I don't want to provide details that are not precise. So we'll share all the details in the next few days. Thank you very much. Pascal Arachneau, Radio-Canada. Yes, my question is for Minister Cardy. Could you please explain to us in French the decision of putting in place measures in all schools, and you will take away some restrictions in high schools when the rates desired will be reached? Could you explain to that, please? Could you explain that, please? Yes. In high schools, the school team, except those who cannot get vaccinated, and all students can receive a vaccination. The only reason not to have a vaccine in a high school, it's a personal choice or a medical condition. The medical condition, we understand that. We will make accommodations, and this is a reason why we want to see a vaccination rate that is high to protect those who cannot get vaccinated. So it's not the case for youth from K to 8. It's impossible today for 12 and under to get vaccinated. So it is clear that there are people who cannot get vaccinated within this group, but as a whole, no New Brunswicker under age 12 can get vaccinated. So this is why we have a little more strict measures for children, for example, from K to 8. But I'd like to mention that in some schools, it can be from K to 12. Restrictions for younger ones will be imposed to everyone. I want to specify that for schools, especially in rural areas. So this will cause some disruptions. This will take away from a regular experience at school. The only way to go forward is for everyone to get vaccinated. There's no reason for New Brunswickers here in the province, 12 and older, to avoid getting the vaccine. We can see now hundreds of millions of vaccines being distributed. Pfizer, Moderna, AstraZeneca, and the other vaccines, they work. They work. They control the COVID-19. COVID-19 continues, in fact, to evolve. There are new variants. Why? Because there are people who are not getting vaccinated. So we need to stop COVID-19. Please get vaccinated. Please vaccinated. It's the only way of changing things and stop the pandemic. However, we'll continue to see new variants, and that is not acceptable in my mind.
Deuxième question, Monsieur Cardy.
Second question, Mr. Cardy. You mentioned earlier in English that you're favorable to mandatory vaccination for students above 12 years old. Could you please tell us why? I think that my perspective for vaccines regarding children is rather clear. My team is laughing at me here in the room. We need to protect, in fact, our youth, and the most vulnerable. We have a Delta variant now that is just as transmissible as other diseases, a disease that can kill people. So we need to do everything to contribute to this world battle so that we don't see, in fact, the evolution of another variant that is even more dangerous for everyone. The only way is to make sure that the virus cannot be transmitted. The virus is not very busy. If it doesn't discriminate no matter what your age. The variant won't decide to be in one school or another or in another facility. To protect people against transmissible disease, we need to use the miracle of science that are offered to us, being the vaccine. So that's why I encourage everyone to get vaccinated. 12 and over, I hope. Hopefully 5 years and up, and hopefully after that, everyone. Bill Hunt, Brunswick News.
Bill? Okay, avant qu'on quitte, y a-t-il des questions before we wrap it up? Are there any additional questions?
Any additional questions?
For Minister Cardy, can you just describe your role in pushing your caucus and your cabinet for mandatory vaccines in New Brunswick?
You know, we had a fantastic series of cabinet conversations and caucus conversations around this. And I was thrilled about how just about every single member of caucus, without any pressure from anyone or any encouragement from anyone, just came out and said, we need to stand up and protect New Brunswickers. So you've got a government here that has, throughout the pandemic, listened to science. With the all-party committee, we heard other voices from other parties that helped to back that up. So that doesn't reflect anything special or great about anyone involved in government or any of the political parties. It shows that New Brunswickers, as a collective, have gotten the danger of this pandemic from the outset and have stood up ready to make the right steps to protect each other throughout it. And I don't think that's changed, and I think that's where you saw the data changed, the science changed, the threat from Delta became clearer, it became clear that it was more severe, and government responded appropriately. And I think that's something that we can all be proud of. And I'm proud to be part of a team that made that call.
And just very quickly, is there anything else missing from New Brunswick's larger response or set of measures to respond to the pandemic as it is now? Is there anything else you want to see happen?
Well, I think what we're waiting for now is just the work that's going on behind the scenes with public health, broader Department of Health, WorkSafe, other departments in government to get us ready with the mandatory vaccination and testing plan. Because of course, the details are going to be complicated. This is not something that has happened recently. It has happened in the past. There have been mandatory vaccine programs for smallpox and some other diseases that ravaged our province in the past. So I expect we'll see that same level of attention to detail and care that's marked pretty much everything that public health has done over the course of their response to this pandemic. So we're looking forward to, in my department, continuing to work with them to make sure that we get this right. But no, I think right now we're in the right place. But as Dr. Muick says, the new report comes out tomorrow. We won't hesitate to take that into account for the reopening of school, for the way we handle the broad pandemic programs, and we've heard that message consistently from the Premier, from Dr. Russell, from Minister Shepherd, from Dr. Muick, and we're going to continue to act in a way that's united and that's based on science, because that's the way we get through this.
That concludes today's COVID-19 back to school update for New Brunswick for the 2021-2022 school year. I just posted on our Facebook page the full guide, and that is available online if you want to check it out. If you have more specific information you'd like to know about mask use in schools and whatnot, I know a lot of it was covered in the update, but again, it's a lot to digest at one time. So the full guideline, I just posted it. It's at the top of our Facebook page right now. If you have questions, I know I do, and I need to refresh and read it right now. I appreciate you joining us. We heard from Minister Cardy and Dr. Muick, who is the Deputy Chief Medical Officer of Health for New Brunswick. If you do have questions or concerns, I imagine there will be more updates before the school year resumes. You can always email me at Vicky, vicki.hogarth, HOGARTH at CHCO.TV, or to our main news email, news@CHCO.TV, and I will try to address them in the conferences. I know that many of you were talking on Facebook about what some of your questions and concerns were. I will try to get an answer for those of you who do have custody agreements with children who go across the border to the U.S. And return. If things will be different for them, I will find out. I will let you know. I will post it on our Facebook page. So I always recommend following us on Facebook, because anytime I have information, I do share it there. Our Facebook name is CHCO Television, and it's at CHCO-TV if you're looking for it specifically, but it's a great way to follow whatever information we have as we know it. It's posted there, and I look forward to you joining me next time. Thank you. I am Vicky Hogarth at the CHCO News Desk. Thanks a lot.
This has been a news and public affairs production of CHCO-TV, New Brunswick's only source for independent community television.